Welcome back. It has been 5 years today since the World Health Organization declared COVID-19 a global pandemic. And the world, of course, as we knew it, changed on that day. Well, joining us this morning, we have Dr. Emily Landon, an infectious disease specialist at the University of Chicago Medicine. Thank you so much for being with us this morning.
Happy to be here.
Oh, great to hear that. Let's take a look back on that day. How prepared or unprepared was the medical community at that time?
Well, I think it was a good combination of both.
Yeah.
So many of us had been watching the situation since the end of December, beginning of January, and had a very good understanding of how significant this was going to be in terms of the impact on daily life and sort of what was going to happen to everyday Americans. But I don't think anybody really understood how much of an impact that was going to be. And I don't think that we were quite where we needed to be from a public health standpoint in terms of having the PPE or personal protective equipment or the protocols or the tests that we needed in order to decrease that impact and make things a little smoother.
We have changed so much. What did we learn from the pandemic?
Well, I'm hoping that we learned that it's much better to be prepared than it is to be reactive, and that being proactive with health threats is always going to be less of a problem for Americans, less of a problem for regular everyday people across the globe than it is to just be reactive to things that come our way. But I'm seeing some signs that we are sort of slipping back into the reactive way of doing things these days, and I wish we weren't doing that.
And we're going to talk about that in a little bit. But first, I want to focus on the health professionals. What impact have you seen the pandemic have on health professionals in today's world?
Well, a lot of us got really burned out. I know I did, and a lot of my colleagues did. We saw a lot of older individuals sort of hold off on retirement at first and then go ahead and retire pretty quickly after things were over, at least in the infectious diseases field, which is good. Now we have a lot of young people and really bright and really smart and really motivated people coming into the field. But I think in general, overall, if you look at the whole spectrum from radiology techs to nurses to food service workers and environmental service workers, there's been a lot more turnover. The pandemic really brought home some of the risk and some of the expectations that we have of healthcare workers, and the way people were treated really supported in the beginning, but then maybe in some places really disrespected and hated, even, I would say, was, I think, tough on the profession in general.
And though we're not in the pandemic anymore, COVID-19 is still an issue for many people. What do we know about long COVID at this point?
There are still a lot of patients suffering from long COVID. I take care of a number of them in my clinic. We still see people that have long-term consequences of a COVID infection. Now, a lot of people tend to think of it as being like the flu, which we heard a lot of early in 2020 as well. But really what we're seeing is that some people unexpectedly end up with, even after a mild infection, they can be relatively sick, have really bad sinusitis that goes on, or their heart is now racing and it takes them months to sort of get past that. That can still happen to people, so it's worth avoiding.
And you talked about earlier being proactive as opposed to reactive, with the United States withdrawing from the World Health Organization. How might that impact our ability to deal with the next big issue?
Yeah, it's definitely going to have an impact.
Yeah.
Not communicating and participating with the global community and pooling our resources to try and better understand the epidemiologic picture, put that puzzle together before things show up on our doorstep is really important. But the loss of USAID is another big problem. They were huge partners of ours in terms of controlling and containing threats, especially health threats, in country when they happen abroad. We really don't want those things coming to our doors because we don't have people there to help reinforce some of these other countries that just don't have the same resources that we do. I think that's a big mistake.
Well, Dr. Emily Landon, thanks so much for being with us this morning. We were talking about how hard to believe it's been 5 years, feels so long ago, and also feels like it was just yesterday at the same time.
Completely agree.
Yeah, really appreciate your perspective.
Thanks for having me.